I'm going to do a little bit about labour now, and for this I'm going to put this doll in and just pretend that I am pregnant. So I want to show you that I want this baby's chin on its chest and back in a forward position, so that whenever the chin is on the chest, you're pointing the vertex, the point of the baby's head, which gives the smallest possible diameters of the baby to come through your pelvis, which is why we were talking about optimal fetal positioning, getting that baby in a really good position. So this baby is going to be lying with its back on my left side, and the baby's kicks would be off to the right, and the baby's tickly hands are on my right as well, but low down. So the baby's chin is on its chest, its vertex is being pointed into my pelvis, so that it makes it much easier to get into the pelvis, to fit in, and to help you with labour, and help me with labour in this particular case. So what is labour? What labour is that for those of us who haven't had a baby before, our cervixes are 3 centimetres long and tightly closed. For the baby to come out, the cervix has to change to be as thin as the skin when you stretch your forefinger and your thumb, and 10 centimetres dilated to fit a baby through and out. And that's what labour is about, doing this 3 centimetre dilated to being thin and then dilated. Okay, that's what your body is doing. So with the contractions or the forces or those energy rushes in your uterus, that's what they're doing. They're opening your cervix, making the cervix opening, which is really just the opening of the uterus, as thin as the skin when you stretch your forefinger, and then for the dilation to happen, which is what labour is about. If you can imagine, that 3 centimetre thick cervix has to go thin first before dilation happens. So the 3 centimetres has to change to this paper thin. We call that effacement, okay, in the official term. So the cervix, the opening of the uterus, has to go from that 3 centimetres thickness to being this thin before dilation can happen. So what happens at this stage? What's going on with a woman who hasn't had a baby before? Your body has to coordinate. The uterus has to learn how to contract. It has to contract so that it's getting your baby, pushing the baby's head right down onto the cervix. I liken the baby's head pushing onto your cervix, helping you in labour really well, because it's a little bit like you pulling on a tight polo neck jumper. If you're pulling on a tight polo neck jumper on your head, the polo neck is stretching open, and that's what is helping with the baby on your cervix. It's helping that cervix to open. So that's really good, which is all about why optimal fetal positioning, those upward movements, those mobilities, those forward positions, upward, forward positions, really helping a baby to come out. So in the beginning, what happens with labour is contractions start, usually. If a baby's in a really good position, contractions start first, not the waters first, breaking, usually. Babies, whenever they're in a good position with their back to your side or to your front, that there is a really good application of the head on the cervix, and therefore that's why the waters don't break first. It's usually contractions will start first. There might be a little bit of achiness in your hips or the tops of your legs. Anybody who had period pain before will remember those feelings of that achiness, and that's what it's like, just this achiness, and you feel something's happening. I wonder what's happening. Might be happening today. I don't know. I'm not too sure. Yeah, the baby's movements are good. I'm feeling that the baby's really good and comfortable. But what is that? I'm just not sure. Could be something happening. You might find whenever you go to the toilet and wipe yourself that there's a show. Okay, a show is literally whenever you're wiping yourself that there might be a bit more mucus and a little bit of blood, as in red blood tinge on your wipe. Or it could be an old blood, so it might be a little bit brownish coloured. But it's just a wipe and it's gone. There's nothing like a bleed on a pad or anything like that. This is just a wipe and it's gone. Or whenever you go to the toilet or have a look in your knickers, it might be on your knickers with that achiness. So this achiness is this pre-labor stage. And as I said, it's all about getting that cervix to change from 3 centimeters long to being effaced. Now this is a time that women do think that they might be in labor, and this is the time when you might have heard of women coming up and saying that they're in labor, that they're having contractions and that it's happening regular and strong, and it's been going on for the last 6 hours, 8 hours, 10 hours, 12 hours, 24, 48 hours. And then whenever they come into the hospital and we assess them, or they see the midwife and they're assessed, the assessment that tells us what's going on is a vaginal examination. And on vaginal examination, the midwife might say to the woman, "Oh, that's great, you're 1 centimetre dilated." And to be in labour and to get into the labour ward, mostly we'd like you to be in really good established labour, and mostly that would mean 3 to 4 centimetres dilated. So this early stage of labour is really important, that you've got your home really well set up, and all of those 20-minute blocks of doing things, or baking a cake or making a stew or doing something really good, like going for a walk on the beach, really, really, really good for you. Watching those good films or those series and living through them. And what I talk about with this achiness is that this is a time where you might be saying, "Oh, I wonder what that is. Oh, it could be that. I don't know. I'm not sure. It could be labour." And you could be on the ball. You might be sitting and bouncing, or you might be doing your rock and rolling, or you might be kneeling down and doing that. Or, as I said, getting in the shower. One of the really good things to do would be to try and go to bed and have some sleep. But this is the time that women think that they might be in labour. But one of the keys for it is that if you can talk your way through the contraction, we don't consider that that's a strong, regular contraction. So you might feel that, "Oh, yeah, I know," and you might phone your mum, "Yeah, I know, I think that I'm starting in labour. Oh, I know, and I've got my hips and my lower tummy, and I can feel it. Yeah, oh, I know it's really sore, and it's going. Oh, it's just going now. Yeah, it's gone." And that might go on for a couple of hours. And as long as the baby's feeling good, as long as the movements are there and you're feeling that they're doing nicely, then that's perfect. Go through it, live through it, you can do it. You can do this. Practice your breathings, practice your relaxations in between. This kind of thing might be happening once every 10 minutes, once every 15 minutes, once every 20 minutes. It might be more regular than that or less regular, and just wait and see. But we call this the early phase, this very early phase of shortening the cervix, getting it ready for dilation.